We are going to go to our GMA cover story. It's about Serena Williams. She's opening up to Vogue magazine about her medical ordeal after giving birth. You know, she suffered some serious complications this morning. We have your first look at her story.
When Serena Williams gave birth to daughter Olympia last fall, it seemed like the natural conclusion to an easy pregnancy.
I felt you kick yesterday. It was amazing.
Just another day in the neighborhood.
But this morning, in the February issue of Vogue, the Queen of the Courts is revealing the dramatic story behind the birth of her daughter and life as a new mom. Williams saying she had to deliver baby Olympia by emergency C-section in September, saying the moment her new daughter was laid on her chest was an amazing feeling, and then everything went bad. After feeling short of breath, a CT scan revealed that Williams had a pulmonary embolism and other blood clots, which set off coughing fits that burst her C-section incision. She then had to have additional surgery to correct and prevent more clots from forming. The whole time, Williams and her now husband keeping her condition private, even as they shared quick glimpses of their new baby girl online.
So we're leaving the hospital after we had a lot of complications, but look who we got. We got a baby girl.
Williams says after arriving home, she was bedridden for 6 weeks and making the adjustment to now being a mom. The 36-year-old saying, no one talks about the low moments, the pressure you feel, the incredible letdown every time you hear the baby cry. I've broken down, I don't know how many times. Why do I feel so sad when I have a beautiful baby? The emotions are insane. But now Williams says she's almost back at full strength, showing off her moves in this new video for Vogue, embracing life as a new wife and mom, and hoping to return to compete in March.
So Serena, Jen is here to talk about this C-section. This is really, people need to understand the seriousness of when you have this
This is not a manicure or a haircut. It's one of the most common surgeries done in this country, and the vast majority of time, to be clear, everything goes smoothly. But depending on whether it's an emergency or crash section, whether it's routine, whether it's elective, depending on the hospital, the stage in pregnancy, there can be complication rates. Data has shown as high as 30%. And I want to be clear, these can be very minor complications, or these can be major or life-threatening. And when you take a look at this list of complications, bleeding, which can be in some cases hemorrhage, infection both in the uterus and in the skin incision, damage to internal organs like the bladder, bowel, blood clots in the leg, the torso or lung, rare risk of anesthesia complications, rare risk of fetal complications. But these things do happen, and they can happen to an elite athlete. They can happen to an everyday woman, regardless of the doctor or anything else.
We saw in the Senate piece that she has had some issues, blood clotting, and that. How could that possibly have been a factor?
So let's do a little deeper dive on a DVT or a pulmonary embolus. This is something that there are certain risk factors that we know about. Being pregnant is a major risk factor. Having pelvic surgery, being immobilized, someone with a past history of a pulmonary embolus is at greater risk in the future. And I want to show you exactly what's going on there. If you imagine this as your blood vessel, the veins either in your leg, your torso, a blood clot forms there. If this clot dislodges, travels to the heart, the lungs, it can range from a minor issue with breathing, or it can be fatal, because this actually clogs up the blood vessels in the lung, and the heart can't beat against that, the blood can't get oxygenation. Then you require blood thinning medications, and that can cause complications if given in the immediate postoperative period.
That's a great example right there.
Plumbing, the plumbing problem.
Comes down to plumbing. You mentioned about elite athlete. It doesn't matter. Being a mama is not easy.
Listen,
becoming a mom.
I've said it before, pregnancy and childbirth are athletic events. That doesn't mean that an elite athlete can breeze through. I've delivered over 1,500 babies.
Wow.
It's rare that I see a mother who goes through it without, any kind of challenge. So again, does she have resources that other people do? Yes, but it is difficult, and you have to be patient with yourself.
And it's wonderful that she's being so revealing in this issue.
Absolutely.
And then when we saw her move, did you see her busting those moves?
Yep.
She's going to be back on the court before we know it, but we're glad that she and her baby are doing well. Thank you, Jen. And the February issue of Vogue hits newsstands nationwide next Tuesday, January 16th. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.